Today we're going to be discussing a citation that the Illinois Department of Public Health recently issued to Waverly Place of Stockton nursing home after a resident there suffered a fractured hip during an unsafe transfer. My name is Barry Doyle. I'm a lawyer in Skokie practicing nursing home abuse and neglect work throughout the state of Illinois. I'm also the author of Built to Fail, a free report available for download from my website, which spells out how the nursing home business model inevitably produces unnecessary injuries and deaths for nursing home residents. The resident who was involved in this incident had a history of having had a stroke, and because of this history of having had a stroke, she had residual weakness on one side. This made her a fall risk, and for that reason there was a care plan that was put into place that called for the assistive 2 with a mechanical lift for all transfers. In other words, when the resident was being moved from bed to wheelchair, wheelchair to chair, a mechanical lift was supposed to be used with 2 staff people involved. On the day of this particular incident, the resident was being transferred from her bed to the wheelchair. The aide who was involved in this transfer was not using a mechanical lift and didn't have the assist of any other staff member. The aide attempted to use what was called a pivot transfer technique to move the resident from her bed to her wheelchair. As she did so, the resident's legs gave out and she fell to the ground suffering a broken hip, which required surgical repair. Now, there's an obvious cause of this fall, and that's the aide failing to follow the care plan. The care plan called for the use of a mechanical lift, not a manual transfer. It called for the assistive 2 staff members, which is the proper way to do a transfer using mechanical lift. There was only 1 staff member on hand when this transfer was being done. So there was a reasonable care plan in place that was intended to address this very risk that came to fruition, but because the staff member failed to follow that, we had this very preventable injury. There's probably a deeper level to this, though, and that relates to the understaffing of the nursing home. Many nursing homes are in fact understaffed, and one of the ways that we see evidence of this is when you see staff members taking shortcuts in the care that they're providing to the resident. It certainly would have been more time consuming for this aide to get the mechanical lift, to wait for another staff member to arrive to help with the transfer, and instead this resident or this staff member took the chance of transferring the resident using this pivot transfer technique, and unfortunately the risk that the aide took didn't pay off for this resident, and she suffered a very avoidable injury. Often, when we see these kinds of injuries occur because staff members are doing things that they really should know better than to try, this is often a sign that they have more work than they have time to get it done, which is a sign of an understaffed nursing home. I hope you found this interesting. If you have any questions regarding this or any other nursing home abuse and neglect issue, please feel free to reach out to us. Our number is 312-263-1080, or we can be reached on the internet at www.accidentlawillinois.com. Thanks for watching.